We've officially reported 5 new cases today, all locally acquired. I can also advise that there are a further 6 locally acquired cases that came through after the late night cut-off.
Of Victoria's official new cases, 3 are linked to the Arcare Maidstone facility, which yesterday revealed one of its workers has tested positive.
One is a staff member at that same Arcare Maidstone who worked alongside that initial case. She was not vaccinated. She also worked at another aged care facility.
Despite guidelines being introduced last year to stop staff working across multiple sites, 3 more aged care homes went into lockdown due to cross-contamination. All cases so far are within federally controlled private homes.
The answer to that is public aged care is a responsibility of the state government. Private aged care is a responsibility of the federal government.
It's been revealed today that those cross-site work bans were removed from private sector homes in November last year.
It's a question for the Commonwealth. It's a Commonwealth workforce. It is massively risky to move across different settings.
The federal government reinstated the guidelines late last week, but that may be too late.
It's very much a medical decision and medical advice, and we follow that medical advice.
This lack of clarity is at the heart of the aged care outbreak. Last week, the Health Minister guaranteed all aged care residents in Victoria would have at least their first dose by Friday.
Well, it's 99% completed, 100% tomorrow.
Except it wasn't. Over the weekend, we learned that 100% figure had not been reached. The Minister then claiming any lack of uptake was down to residents refusing the jab.
The vaccination program is a consent-based program.
Except some families dispute that claim and insist they've been desperate for the vaccine for months. They're demanding answers from the government and fearing for their loved ones.
Well, Kate's 95-year-old grandmother is in a federally regulated aged care facility and is still waiting on her vaccination, and she joins us now. Kate, how keen is she for this vaccine?
Well, she, like the rest of our family, is incredibly keen, and we've been keen since the Phase 1A rollout was announced in February, and we've done all that we can to try and make sure that she is vaccinated.
So, Kate, have you managed to get to the bottom of why this has not been done? I mean, who's to blame here? Is it the home? Is it a lack of supply of vaccine? Is it the government? Where's the problem?
Well, we've been emailing since the start of March to try and get some understanding about who's responsible. And, you know, I'm over the politicking of this. I just want my grandmother vaccinated. But we've sent numerous emails to the health department. We've even contacted local, state and federal MPs to try and get some answers. And we're just not getting any answers, you know, on this.
And have you managed to get a sense of how many other people in that home are in a similar situation?
Nobody in the home has been vaccinated, despite all of us giving consent. So we were given consent proactively by the home in March, and we very promptly on the 22nd of March sent those consent forms back. So the whole notion of the fact that all aged care facilities in Victoria have been vaccinated and only the ones that have not given consent haven't is absolutely not correct.
Kate, this makes me so angry. We've got family in aged care as well waiting for their second dose. It is taking far too long, especially given what we saw happen last year. We know what happens if you don't look after the elderly. But given the outbreak at the moment is spreading within aged care facilities, are you feeling anxious?
Incredibly anxious. You know, we're doing all that we can. And, you know, today Professor Kidd came and said, you know, that being vaccinated shows you care about everybody in the country. Well, show that you care about my grandmother, you know, and start acting, start getting these people vaccinated. They're our most vulnerable and we're letting them down.
Kate, you said something that could potentially be a big story, if I've got this right. So you're saying that in your grandma's home, no one has been vaccinated. Just
none
first
of
point.
the residents.
So none of the residents. So you mean they haven't received any of their jabs, or do you mean they haven't been fully vaccinated?
No, they've not received one jab yet. So they've not had one vaccination yet. So they're waiting on their first dose. I believe less than half of the aged care workers have off their own bat gone and got vaccinations, but the others are still remaining.
All right. Can I ask you how recent that information is? Because that's been... We knew that as recently as a week or two ago, quite a few homes hadn't been vaccinated, but now we're hearing the exact opposite from the Health Minister. So are you saying that as of today, still no one has been vaccinated amongst the residents in that home, or is that information, say, 5 days a week old?
No, that is as of this afternoon.
That's extraordinary. And how have you managed to find that out? Did you ring the home themselves or anything like that?
Yeah, we're in constant contact with the home and trying to find out information, as are they, constantly sending emails and trying to get to the bottom of this. So the aged care facility is doing all that they can to keep their residents protected. They've gone into voluntary lockdown as soon as it was called from Melbourne. So they have been in lockdown, as have we all here.
And in the communications you've had from the home, they haven't explained to you exactly what the hold-up is?
They're trying to get to the bottom of the hold-up as well. So they're making repeated calls. And as I said, as of the last indication that we had is that they were booked in for the 2nd of June. So that's on Wednesday. So we're hoping that, like has been the case with receiving single doses for some of the other facilities and second doses, we're hoping that comes into action sooner rather than later.
Well, Kate, we will keep following this for you, but we appreciate your time tonight and, yeah, we hope your grandmother and all the other residents stay safe.
Thank you.
That's so interesting because the Health Minister, Greg Hunt, today insisted that 100% of facilities in Victoria had that first dose. And, yeah, obviously there's a discrepancy there, which we will follow up on.
It couldn't be a more stark discrepancy. That blows me away. So we have to look into that, don't we? We did invite the Health Minister, by the way, that is Greg Hunt at the federal level, and the Aged Care Minister, Richard Colbeck, to speak with us tonight, but both declined. OK, we've got to take a break. We'll see you on the other side. Stay with us. From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.